The Primary Healthcare Summit, themed Reimagining Primary Healthcare in Nigeria, organized by the National Primary Healthcare Development Agency, is aimed at motivating stakeholders to invest in the implementation of the strategy to revitalize primary healthcare in the country. Vice President Professor Yemi Osibanjo said in order to achieve universal health coverage, the primary healthcare system has to be revitalized while listing 3 critical trends that have to be tackled.
A lot more needs to be done. And permit me just 3 trends of thought very quickly as we reimagine primary healthcare in Nigeria. The first, of course, is dealing with out-of-pocket expenses. And I think we clearly need compulsory health insurance. The second is addressing some of the drawbacks occasioned by the concurrent constitutional status of primary healthcare. There's a great need for synergy to prevent a situation where the federal, state governments and local governments and private persons duplicate primary healthcare facilities, and there is no real planning around what should be where. The third is encouraging and supporting serious private sector interventions.
Minister of Health Dr. Osagie Ehanire said if the primary healthcare system is strengthened, it will ensure the availability of quality healthcare to citizens at their designated communities.
In plain terms, we urgently need to ensure the availability of service at designated communities, which is at least 1 functional primary healthcare center per ward, along with an adequate complement of human resource for health. The foundation of any strong health system and for universal health coverage rests on a robust, resilient PHC system, where health experts reckon that up to 70% of the country's disease burden can be treated, and vital disease prevention and health promotion education can be given.
Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib, enumerated ways in which primary healthcare will be strengthened in the country.
Now is the time for us to treat our healthcare as the emergency that it is. The 4-point agenda from the Federal Ministry of Health and Nphcda revolves around improving access and service delivery through primary healthcare revitalization, ensuring that working with communities, religious and traditional leaders, that we stimulate demand for primary healthcare services. But it's also important to ensure that we are providing more health for the money that we get. Of course, working with our partners, the private sector, working with the states, the local governments, community-based organizations, we'll be using the right enablers and capabilities to support the delivery of this strategy.
Highlight of the summit was the unveiling of 5 documents for reimagining primary healthcare in Nigeria. Lois Apasambu, ASO Television News.